Hello there, my name is Jim Dark. I'm from the UK, from Buckinghamshire, and I've just finished 8 weeks at the 3D clinic here, very successfully. Anyway, my problem started about 2.25 years ago down there, and the pain slowly increased until it became almost unbearable. I went to the GP and they diagnosed, they thought, epididymitis. I then went to see a urologist who also, very strangely, diagnosed epididymitis. And so I went to see a different urologist. He was a lot more scientific, and he conducted a proper series of tests and came up with the diagnosis of prostatitis. All I knew was it hurt a heck of a lot. The second urologist was a lot more scientific about the way he did it. He did a ultrasound, a flow test, a good old DRE, which we all love and hate, plus the questionnaire, the IPSS questionnaire. He then sent me for an MRI scan of the prostate and pelvis, and luckily that showed no cancer. He then recommended a cystoscopy. This was the first of 2. And for 3 days, I had blessed relief. Unfortunately, going off and playing golf didn't exactly help things, and it all flooded back. So I then bumped along for the next 16 months. However, before I had the first cystoscopy, I did find on the net, with a prostatitis search, the 3D clinic. So I thought, okay, well, it's a long stop. Never really thinking I'd ever actually come to China. But come to China I eventually did. Anyway, back to 16 months in between, I was bumping along, things slowly got quite a lot worse again. So 16 months later, October last year, 2015, I had another cystoscopy. No real change after this one. In fact, if anything, it was even worse. However, the urologist this time did find some bugs, as he said. On the first cystoscopy, it was the cultures were completely inert. By the way, he's saying to me at that point was, no known cause, no known cure for prostatitis. Well, there is. Anyway, on the second cystoscopy, they found some bugs. I won't bother to name them here, but they weren't quite the same as the bugs that were found when I got to the 3D clinic. But at least they found some bugs. My urologist actually was saying that he thought that I was probably going towards the HOLEP operation, where they carve away, and I use that word purposely, they carve away a chunk of your prostate. Just go and have a look on YouTube and you'll find out how it's done. Now, whether they use a hot wire in the TURPS operation or they use HOLEP, that's probably up to you. Anyway, I just asked him, well, if there's bugs in the prostate and you carve some of it away, that leaves part of the prostate with bugs in it. No real answer to that one. I'd also asked him previously, is it the prostate that hurts, or is it the bladder that hurts, which he told me was very inflamed? Good question, he said. No answer to that one either. So I was left in no doubt as to, they don't really know enough about this business at all. After nearly 2 years of this, you get to be quite an expert, layman expert of prostates. And you have your own opinions. However, I did try his final antibiotic 2-week regime before I finally decided to come to it's a pretty big decision really. China's not exactly the place on my normal sort of itinerary. Although I've always wanted to come, this is not the tourist China. This is a working city. And I've enjoyed the last 8 weeks. I shall be very sorry to leave. I'm going to be very sorry to get home. I'm going to be very sorry to leave. I've really enjoyed it. People are great, very sociable. They stare at you a bit, but you'll get used to that.